To be able to read a radiograph, an understanding of human anatomy is necessary. Imagine a person is standing directly in front and facing you. The person, now patient's right side, is on your left, and their left side is on your right, similar to a mirror image. The patient's hands are positioned slightly away from the body, with palms outward facing you. This position is known as the standard anatomic position. The inside or palm of the hand is anterior, called palmar, and the back of the hand is posterior, dorsal. The top of the foot is called the dorsum and is anterior, while the sole is called the plantar and is posterior. The term dorsum or dorsal in general refers to the vertebral or posterior part of the body. However, when used in relationship with the foot, dorsum specifically refers to the upper surface or interior aspect of the foot opposite the sole, whereas for the hand, it refers to the back or posterior surface opposite the palm. Now imagine an invisible line cutting the patient into equal right and left halves. This is called the median sagittal or mid-sagittal plane. Anything positioned closer to the mid-sagittal plane is more medial, and anything positioned further away from it, closer to the edges of the body, is more lateral. Any plane parallel to the mid-sagittal plane, but more lateral to it, is called a sagittal plane. Another line that we use to divide the patient into anatomical sections is the coronal plane. This line splits the patient into front and back, also known as ventral and dorsal, or anterior and posterior. The last line is known as the transverse or axial plane, which splits the patient horizontally into upper and lower halves, also called superior and inferior. There is also one additional plane called the oblique plane, but it is very rarely used. The human body is composed of the head, neck, torso, or trunk, and the extremities, your arms and legs. The trunk is considered the core of the body, as everything else is attached to it. It also contains the majority of the body's organs. In anatomy, anything closer to the trunk, your reference point, is dubbed more proximal, and anything further away from it is more distal. Your shoulder is more proximal than your elbow, and your toes are more distal than your knees. Cephalad, or cephalic, is a term meaning toward the head end of the body, which is superior, while caudad, or caudal, means away from the head or inferior. The adult human skeleton is composed of 206 bones. These are split into the axial skeleton, which is made up of the skull and spine, and the appendicular skeleton, which includes the pelvis, scapulae, clavicles, arms, and legs. Bones are split into 5 groups: flat bones, such as the skull and scapula; long bones, like the humerus and femur; short bones, the carpals and tarsals; irregular bones, like the spinal vertebrae; and sesamoid bones, such as the patella. There is also a 6th kind of bone called sutural bone, which is present in the skull. Bones are filled with bone marrow, which is a type of special spongy bone that produces blood cells and platelets. The cavity containing this spongy bone is called the medullary cavity, and it is surrounded by a tough and compact bone called the cortex, which is what we see when we look at bones from the outside. Long bones and some flat ones like the ribs are split into segments called the epiphysis, the metaphysis, and the diaphysis. These are also called the head, neck, and shaft, or body, of the bone. Children have a layer of cartilage between the epiphysis and the metaphysis called the epiphyseal plate or growth plate. These plates are growth sites in the bones, allowing them to increase in length with age before completely closing through ossification, which is the process of cartilage turning into bone around the end of puberty, about the age of 18. Your arm is split into 5 main groups, which are the hand and wrist, the forearm, the elbow, the upper arm, and the shoulder girdle. We'll begin with Group 1 and work our way up. The hand and wrist are made up of 27 bones. The phalanges, which are your fingers or digits, equal 14 bones. There are 3 bones in every finger except the thumb, which only has 2. The joints between the phalanges are called interphalangeal joints. The joint further away from the hand, and therefore the trunk, is called the distal interphalangeal joint, or DIP, and the joint closer is called the proximal interphalangeal joint, or PIP. The bones in your palm are called the metacarpals and equal 5, one for each finger. The joints between your most proximal phalanges and your metacarpals are called metacarpophalangeal joints. Last 8 bones are your carpals or wrist bones. The joints between your carpals and metacarpals are called carpometacarpal joints. You may notice that when naming joints, the bones involved are ordered proximal to distal and not the other way around. Personally, I think this makes them easier to remember.